Guys, this is Mobeen. We're talking about cardiovascular system. This is the first lecture in the cardiovascular system physiology, the general principles. The topics that we'll cover today are going to be pretty simple. It is a start of the CVS. So the organization of the cardiovascular system, the heart as two separate pumps, the series and parallel circuits in the CVS, the chemical composition or the oxygen and carbon dioxide levels at various parts in the cardiovascular channel, direction of the blood flow in this circuit, and what do we mean by the systemic tissue and what are the systemic tissues. This is really important. You'll use this term throughout your medical career. And then various pressures and their definitions. We're not going to treat these things in detail here. There will be separate lectures, but just their definition so you can get started, and when these terms come up, you at least know what that means. So with this, let's start with the heart. So the USMLE wants you to know what are the heart's chambers, what are the valves, how does the blood flow in those chambers. So this is that lecture. So let's start from here. The heart here that is drawn, and you'll see a picture as well. It has 4 chambers. The 4 chambers are, number 1, if the right heart, right atrium, RA, and left atrium. That is one functional. These are 2 chambers, but one functional unit, also called the right heart. The right heart. Then, of course, left atrium and left ventricle. That makes 2 chambers, left atrium and left ventricle, but that also makes the one functional unit, that is left heart. So I'll make that here. Left heart, consisting of left atrium and left ventricle. The right atrium has 3 inputs. Superior vena cava brings the blood from the head and neck area. Superior vena cava. Inferior vena cava, IVC, brings blood from the rest of the body except the heart, and the coronary sinus that brings blood back from the heart. Coronary sinus. Now remember, heart receives blood to do 2 things. One is it receives blood to pump it out. So that's the pumping function. And the second is it receives blood to use it as its own nutrition as well. So when the heart is pumping the blood, the vessels on the right side are superior vena cava, inferior vena cava, and the coronary sinus. They bring the blood that is pumped out through the pulmonary arteries. So this is pulmonary artery. So here a quick definition of artery. Arteries are all the vessels that bring blood out of the heart, that bring blood from the heart outside towards the tissue. So this is the pulmonary artery that would bring the blood out from the right atrium, right ventricle. Okay, so that is the pulmonary artery, that is the right side. The left side has left atrium, left ventricle. The blood comes in through pulmonary veins, and the definition of veins is all the blood vessels that bring blood to the heart. So pulmonary veins bring oxygenated blood to the heart. These are veins. It is not necessary that vein has deoxygenated blood. Pulmonary veins bring oxygenated blood from the lungs to the heart, and so these are oxygenated blood carriers, but are veins because they are bringing blood to the heart. Okay, so left atrium and left ventricle. Left ventricle in turn pushes the blood or pumps the blood into aorta, and then aorta is connected to the systemic tissues. There are 6 major systemic tissues that you should know about. One of them is cerebrum, or the head and neck area. Coronary tissue, that is the heart itself. Splanchnic tissue, that means GIT, that is intestines, liver, spleen, etc. Renal systems or kidneys, skeletal muscles or just the muscles, the skin, and that makes the systemic tissues. Alright, so now these are the chambers and the arteries and the veins. let's see how this circuit is connected as a two pump system. We can see that here and we can see that here. So this heart, what I've done is I've broken it up. I've broken the heart into two separate structures. One is this is the left heart and this is the right heart. These are now functional units, the working units. So let's see the blood flow in this system. We'll start from the lungs. So here are the lungs. Oxygenated blood, you know that the lungs are connected with the trachea. The trachea is bringing the oxygenated blood from the mouth. Okay, so the oxygenated blood comes from the lungs through the pulmonary veins. These are the pulmonary veins, 4 pulmonary veins, 4 in number, 2 from each lung. They bring the blood into the left atrium. So this is the blood oxygenated that is coming in. Now what do you think about the chemical composition of this blood or the gaseous nature of the blood in this? So oxygen is really high here. Why is oxygen high? Because this is the most oxygenated blood. It is just coming from the lungs and the carbon dioxide levels are less. So that is the chemical composition. So the pulmonary vein and left atrium almost have the same chemical composition, more oxygen, less carbon dioxide. This blood through the mitral valve, we also call it, the same valve is also called bicuspid valve, or it is also called the left atrioventricular valve. Same name, 3 names for one valve. Through this valve, the blood flows from the left atrium to the left ventricle. Again, the composition is similar, more oxygen and less carbon dioxide. From here, the oxygenated blood now passes through aortic valve into the aorta. From the aorta, the blood will be then supplied to the rest of the body tissue. Now remember this, that only left AV valve, this valve is bicuspid or has 2 leaflets. All other valves are tricuspid in the heart. Okay, so the tricuspid valve traditionally is called, this valve, the right AV valve is called a tricuspid valve, although aortic valve is also tricuspid and pulmonary valve is also tricuspid. Anyway, so the blood comes out into the aorta. From here, it goes to the systemic tissues. So now what are the systemic tissues? These tissues, I've put them here as well. They will be called collectively as the body. So the tissues are cerebrum or cerebral system, or the brain or the head and neck area. Then subplanchnic tissue, that is the GIT, liver, spleen, etc. Then is the coronary. I missed the coronary here. Of course, heart itself needs nutrition as well. So the coronary blood vessels supply the heart. So coronary system, that would be bringing blood to the heart. Let's make that here like this. And we'll make a coronary vein, that is, okay, so coronary sinus here. That is the opening of the coronary veins. Coronary sinus. All right, back here, so renal system, skeletal muscles and the skin. So what happens is that the aorta then subdivides into arteries, then arteries divide into arterioles. They make capillaries inside the organ or viscera or the tissue, skeletal tissues. Then those capillaries have the venous end that make venules, then they make veins, and finally the veins would now go back and through either superior vena cava, which is bringing blood back from the head and neck area, or so we call it superior vena cava, or inferior vena cava, which is bringing blood back. So this is the IVC, which is bringing blood back to the right atrium from the rest of the body except the heart, and then the coronary sinus that is bringing blood back from the heart itself, the heart tissue itself. Now this blood that reaches the right atrium is very deoxygenated. So the carbon dioxide levels are really high, CO2 levels are high, oxygen levels are low. The blood that comes from the superior vena cava and inferior vena cava is then mixed with the blood coming back from the heart as well and becomes even more deoxygenated. That deoxygenated blood then falls into the right ventricle. Through what valve? This will be the tricuspid valve or right atrioventricular valve. So right, this valve here is the right AV valve, or also called tricuspid valve. Blood from here then, when the right ventricle contracts, the blood will be coming out of the right ventricle through the pulmonary artery because it is taking the blood out, through the pulmonary artery to the lungs. So that completes. So I'm going to mark this blood vessel as the pulmonary artery. So that is the right heart and the left heart. If we look at this circuit, in a circuit diagram it becomes a little bit more clear. So if you see here, the first thing to understand is heart has two pumps, right and left pump. These pumps are connected with two tissues in series. In series, I said, not parallel. The two tissues are lungs and the rest of the body. Lungs are actually connected to the rest of the body in series. What that means is this: the flow of the blood through the lungs is equal to the flow of the blood through the rest of the body. That is a very important thing. Now, the left heart receives blood from lungs and pumps blood to the body or the systemic tissue. Right heart receives blood from the systemic tissue and pumps blood to the lungs. So this is the serial circuit. I would ask you to draw it to understand it. Also, now look at the body. The body tissues itself, the systemic tissues themselves are now connected in parallel. What that means is that cerebral, coronary, splanchnic, renal, skeletal muscle and skin, they do not receive blood like this. It's not that cerebral tissue got the blood from here, the blood will then go to skin, from there the blood would go to GIT, from there the blood would go to the kidneys. That is terrible. In this one, maybe after 2 or 3rd viscera, the next visceras are going to become deoxygenated, going to receive the deoxygenated blood and start having a problem. So this is not going to work. So systemic tissues, I'm going to put this here so you don't think it's a correct thing. The systemic tissues are connected in parallel. Only the body and lungs are connected in series. So make this very, very clear to you. Alright, so after this, hopefully this is clear. What we understand here is chambers of the heart, valves of the heart, the series circuit, the parallel circuit, and the direction of the blood flow and the chemical composition. Let's talk about the pressures, guys. So the pressures are really important from a couple of reasons here. One, some of these pressures are part of the vital signs. What are the vital signs? The vital signs are, we have the blood pressure, which is systolic and diastolic blood pressure, body temperature, heart rate, breathing rate, and oxygen saturation. I actually think that the pulse pressure should also be part of the vital signs because it is really easy to calculate or derive. So let's talk about the definitions of these pressures. Systolic blood pressure. So definition of systole. Systole is the time interval during which a ventricle is contracting. That is the definition of a systole. Systolic blood pressure, if you come here, systolic blood pressure is the blood pressure in systemic arteries when left ventricle is contracting. It is the blood pressure in systemic arteries when the left ventricle is contracting. That is the definition. Normal average systole in healthy individual adults is 120 millimeter of mercury. So that is a systolic blood pressure. Diastole, the definition of diastole is the time interval during which a ventricle is relaxing and is of course filling with blood. Now diastolic pressure is the blood pressure in systemic arteries during the relaxation of left ventricle. So diastolic blood pressure is the blood pressure in the systemic arteries, measured in the systemic artery or from the systemic arteries during the relaxation of the left ventricle. And normal healthy adult individuals have 80 millimeter of mercury as the diastolic blood pressure. Now pulse pressure. Pulse pressure is the difference between the systolic and diastolic pressure, or it is the delta P, it is the differentials between them. So that means pressure systolic minus pressure diastolic. That is why I said it is easy to calculate. So let's say 120 millimeter of mercury minus 80 millimeter of mercury equals 40 millimeter of mercury is the pulse pressure. So what that says to us is, it says that it is the difference. If this is the diastolic blood pressure 80 and this is the systolic blood pressure 120, it tells us the difference between them. Why is that important? We'll see that in detail at some other point, but just to give you some clinical significance of this, if the pulse pressure becomes narrowed, meaning let's say the blood pressure of the person has dropped from 120 to 110, then the pulse pressure is going to be now 110 minus 80, which is, instead of 40, it is 30. Of course, that is now telling you something. 30 is telling you that there is something that happened and the two pressures have come near each other. Pressures can come near each other when there is blood loss. Pressures can come near each other when the left ventricle contracted and pushed the blood out. So that would create the diastolic blood pressure. But when the blood is now pumping, when the ventricle pushes the blood out, that is systolic blood pressure. And imagine if the blood fell back in the ventricle. That is, imagine if the aortic valve has a regurg, aortic valve is damaged and the blood fell back into the left ventricle, then what would happen? Immediately the pressure would go down. So that would be the narrowing of the pulse. On the other hand, it is also possible, for example, if somebody is doing an exercise, what happens during the exercise is, look here, it's very interesting. During the exercise, the systemic arterial or vascular beds open up. So in the systemic, so what happens is during the exercise, the systemic blood vascular channels have opened up. That reduces the diastolic pressure. At the same time, the heart has started pumping with more force. That has increased the stroke volume. So when the stroke volume is increased, systolic pressure would go up, and when the vascular resistance is reduced, the diastolic would go down. So what would that mean? So let's say diastolic has gone down to 70 and the systolic has gone up to, let's say, 140. Now what is the pulse pressure between them? 70 millimeter Hg of mercury, right? So pulse pressure widening, that means it becomes bigger, or narrowing has a very important meaning. And one should always, as a doctor, as a nurse, one should always make sure that you understand what is the pulse pressure. And if it sounds abnormal, then we need to figure out and research why that is happening. Normally, atherosclerosis, anemia, fever, and many such blood loss, many such things can cause pulse pressure to vary. All right, let's talk about the mean arterial pressure. Mean arterial pressure here, or MAP, the formula is cardiac output multiplied by systemic vascular resistance plus central venous pressure. Now central venous pressure is usually negligible, so we can ignore it. That means mean arterial pressure mostly depends upon the cardiac output and the systemic venous vascular resistance. Usually it is difficult in a clinical setting to just go out and figure out what is the cardiac output and the systemic vascular resistance. So what happens is we have a rough formula that we can use to at least assess the mean arterial pressure. The significance of the mean arterial pressure is this, that it tells you as a doctor the perfusion pressure, and the perfusion pressure is the pressure necessary to bring blood supply to the systemic tissues for their nutritional needs. Normally, if mean arterial pressure falls below 60, then you as a doctor should be concerned. So what if you're sitting in the clinical, in your clinic, or you are in the hospital, and you have the only thing you got is the systolic and diastolic pressure. Can you assess the mean arterial pressure to understand if the perfusion pressure is okay in that patient? So yes, you can. So here is the formula: pressure of the diastole or diastolic pressure plus 1/3 of the difference between systolic and diastolic pressure. So how would we get this difference? We'll take pressure systole minus pressure diastole or diastolic pressure. So if we use that for this healthy individual, we'll say this: 80, that is the diastolic pressure, plus 1/3 of the difference between systolic and diastolic. What is the difference between them? 120 minus 80. So that makes it 80 plus, this would be 40. I'll put 40 here. So this would be 80 plus 40 by 3. 40 by 3 is roughly 13.3. So I'm going to say it 80 plus 13 is 93 millimeter of mercury. That is a mean arterial pressure. So you can assess it. When this pressure goes below 60, you as a doctor must be concerned, because a perfusion pressure of below 60 means patient is not going to get enough perfusion to perfuse their systemic tissues. So again, mean arterial pressure can be used in lieu instead of the systemic pressure. It's a little bit more precise to understand the perfusion pressure is okay as well or not. So thank you very much. Perfusion pressure is really just the mean arterial pressure.